Hi, my name is Dennis. I'm a registered nurse. I'm excited to introduce to you GT Care. So why GT Care? The problem right now in long-term care is nurses are very short-staffed, and we having this crisis, one because of the pandemic, and ideally this has been a chronic problem. It's just been amplified by the pandemic. So if we dig deeper into why nurses are short-staffed and what's the implication of this is you're looking at the nurses ratio to the seniors in long-term care. It's very, very, very daunting. You're looking at a nurse managing at least 1 to 50 seniors in the long-term care. That's a lot. And the nurses don't have extra eyes to look at the patients for the most part. They are working on the administrative part of things and also the clinical part of things. They don't have eyes on the ground. Whereas in the caregivers aspect too, you find that they're also burdened enough. They call in sick most of the time. So that problem now has been amplified in long-term care for the longest part since I remember. And as I work there, I see that every day. So what's the current solution right now? So if a nurse wants to send a patient out there for an appointment, for instance, you want to take the patient out for a dental appointment, they don't have an extra person. They ideally would like to hire a companion to take the senior out, but that route is not there in long-term care. The family members, on the other hand, they have been stopped from coming into this long-term care. And as a matter of fact, family members are also busy. They cannot visit their seniors every day. So it has come to the point whereby they're trying to hire companions to come and see their seniors in long-term care. So as a nurse, I realized that the interaction between the companion and seniors, as it gets enhanced, you find that the senior is more happy and the nurses, the senior is more happy and they spend more time with the companion. Hence, the nurse actually has an extra set of eyes, someone spending time with the senior, and they're not too worried about them. So even if they're short staffed, they end up knowing that someone is actually with that companion. And the senior is safe at that particular point. So if you look at the interaction now, so I was saying the interaction of a companion and senior, that means when they take that time off, the nurse can work on other things. She or he can concentrate on patients who need more extra help. The family member is also their family member is also having some ease on their part. They have a peace of mind knowing that someone is actually taking care of their family member. And the caregiver, on the other hand, they come in and they find a senior who is happy. So when they want to interact with this senior, you find that they're not pushing around when providing care. So what are the advantages of these companions? The companions offer something called instrumental activities of daily living. This could be like transportation to appointments, taking the senior out for leisure activities, or even taking the senior out for just a walk. These are some of the stuff that staffing in nursing facility cannot do because they're really short staffed. And also the companion can help out with things like feeding. That means that the work is a little bit distributed, but they're not part of they're not licensed. So that means they can only perform instrumental ADLs. So how the impact of this overall is that the nurses end up being having at least hours on their time, and also the caregivers. So why are we asking Johnson & Johnson to support us? As nurses, we believe in this idea, and we've seen how every party is excited to come on board. We currently have long-term care facility, hospital rather, that is willing to work with us. And actually, we want to say thank you to Center for Brain Health and Innovation, who believed in this idea, and they gave us a grant of $50,000 to get our product to the 80% completion mark where we are. So the ask we're asking for Johnson & Johnson right now is to go further and look at this interaction between the senior and the companion in order to reduce social isolation and actually reduce the burden of staffing in long-term care is by introducing things like virtual reality techniques solving social isolation. We're also looking at how can we measure the impact that will lead us to be like more analytical on how we can look at the data of antipsychotic use versus how we're helping the patient on with the interaction between the senior and the companion. Also, we're using more technologies like virtual reality. So then we're also asking that we can continue to build our product to completion. We want to build the billing part of it, and also we want to scale this idea not only in long-term care. We want to scale this idea to the community. So in the community, apart from just looking from the psychological aspect of the patient of solving social isolation in long-term care, when they're in the community, for instance, when they come out of the hospital, we want to look at patients in the community. How can we help them now to get even better, like managing their chronic illnesses and actually integrating their medication adherence when they interact with a companion or caregivers. So, and how does the companion play the role of them connecting these seniors to their providers and the nurse practitioners? And hence, we are asking for this money this amount to help us to add more to finish our product, to also scale within the long-term care, and also to scale into community and introduce other aspect of managing social isolation, like virtual reality management. So thank you so much for believing in us, and we're looking forward not to let you guys. Our team is one of the greatest team. Just to speak about it, it's made of 2 nurses, myself and Sharon, and we have we have software engineers called Alani, and we've boosted a lot of experience to having worked together for the past at least 3 years. And we have the support of other institutions like British Columbia Institute of Technology, who is helping us to build the product much further. University of Victoria has helped us with some grants to get our company incorporated. And University of British Columbia, through the Idea Lab, we're working with them to make sure that our idea actually is clinically proven and has an impact. So thank you so much, and we hope that we can bring this. Our success will be your success. Thank you. Bye.